I don't understand this love affair with enclomiphene. Enclomiphene is not testosterone replacement. Ask them, how do you know that? And if they go, I'm a doctor, you're not, then you need to walk out.
Yeah, I had a guy contact me with a personal message, and he said he contacted a well-known TRT doctor on YouTube for his low T symptoms, but he has mid-range testosterone levels, and he was prescribed enclomiphene 25 milligrams every 3 days. So yeah, he posted that in our Facebook group as well, but he wanted to hear your take on that, especially Jordan.
Yeah, I'm not a fan at all. Never of enclomiphene monotherapy, or even, I mean, unless you're doing a PCT or, for a young guy or somebody trying to restart things because they realize they screwed up, or they just have to come off testosterone for some reason. Why? Enclomiphene is not testosterone replacement. Why are you basing this off of a lab range? We should go off symptoms. I don't understand this love affair with enclomiphene. I don't think people understand that the fact that it works, quote unquote, better at boosting the natural levels tells you the negatives of what it's doing, because you have to think about how it's doing that. It's blocking estradiole's effect even more in the brain. That's not a good, healthy thing to do. The reason enclomiphene works better is because it's an actual antagonist, whereas Clomid is a mixture of enclomiphene and I think it's zuclomiphene, which is an agonist. So in theory, Clomid is probably a little healthier because you at least get some estrogenic action in the tissue, which is not bad. So again, this goes back to the presupposition that people have that estrogen is bad. They still are in this mindset, and you have to get out of that. So until people change that paradigm, they're going to keep chasing these rabbit trails that don't mean anything. But enclomiphene can still cause you to feel like crap, and it can still cause vision disturbances, sometimes that never go away. Do you want to roll the dice and be that guy? Why don't you just take testosterone? If it's a fertility question, go back to where we've talked about those protocols and follow that. Then you can feel well and maintain sperm count instead of feeling like crap and possibly maintain a sperm count and causing disturbances and issues that might be permanent. That's my take on it. But these clinics are pushing it because also it's going to be dirt cheap for them to buy and resell. So at the end of the day, these are businesses, and there's nothing wrong with making money, but we're dealing with human beings wanting to make money, and human beings we're not altruistic by nature. We're not. People are looking out for their own interests. It's fine, but you have to decide how far you're willing to let them take you. Like, yeah, they can make a profit, but if they're really pushing something that's not healthy for you just to make the profit, then it's really not okay. I mean, in my opinion. So you got to learn about this stuff, educate yourself, so then you can make the proper decision when somebody tries to push enclomiphene on you as a monotherapy, or an astrozole, or gonadorelin, or phlebotomy, whatever. You are armed with knowledge, so you can go, you know what, I don't, or just ask them. Even if you know, just go, why do you think I should do that? Can you give me some research to prove that I need to be doing this and why? And like, just kind of probe them. And you'll find out real quick if they actually know what they're talking about. If you want to, like I say this every day, if you want to piss somebody off, ask them, how do you know that? Just ask them, and do it kindly, and then just see where they go. And if they go, I'm a doctor, you're not, then you need to walk out.